time. We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you. Thank you, Mr. Speaker. The Premier says there's no crisis in health care. The government says there's enough capacity in the system already, and yet we see people being turned away from emergency rooms. We see physicians leaving the province due to the working conditions. Speaker, we see Nova Scotians struggling to access health care. Here in the real world, there are serious problems in health care. But in the budget world, not so much, Mr. Speaker. So I'd like to ask the Premier, is the message that he is trying to send to Nova Scotians that Nova Scotians and everyone working in health care, that everything is just fine, there are no problems, our health care system is great? Is that the message?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. He would know, Mr. Speaker, if you listen to the budget, there's a 6.2% increase in the budget for health care. Mr. Speaker, you would also know there are 15 resident seats for physicians that'll be dedicated to Haza University, Mr. Speaker, an increase. You would also know we have 10 dedicated seats for nurse practitioners. Continuing, if you had followed over the last number of years, we're hiring almost all of the graduates of the nursing schools in our province, Mr. Speaker. We continue to see the average age of nursing drop because we're continuing to hire more in, Mr. Speaker. We continue to recognize it requires investment in frontline health care. At the same time, we also know through successive governments, Mr. Speaker, the infrastructure of health care has been ignored. It is no longer being ignored, Mr. Speaker. This government has the largest single infrastructure investment in public health care in our province, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Mr. Speaker, last year, this government put an extra $100 million into health care. And I don't think you could find a single Nova Scotian that says the healthcare system is functioning better than it was. This year, they're putting more money in. But if it's not properly managed, you won't get the results. And that's really the problem, Mr. Speaker. Services are not improving. There is a lack of credibility on the healthcare file. And we've all heard about the issues surrounding shortages of nurses and situations where the province is paying huge overtime amounts, or nurses aren't allowed to take vacation. Can the Premier explain travel nurses? Another one. Can the Premier explain why there is no specific additional funding dedicated exclusively for the hiring of nurses, or does the Premier believe there are enough nurses in the province right now?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. As I said in my first answer, Mr. Speaker, we, for the first time of any government in the province, we've dedicated seats for nurse practitioners. We provided a path for RNs in this province, Mr. Speaker, to go while they're continuing to work, to continue to take more training, become nurse practitioners. I also said in my previous answer, Mr. Speaker, we're hiring almost all of the nursing grads in this province, Mr. Speaker. He made a large accusation about the health care in this province. Those 4,000 Nova Scotians at orthopedic surgery last year, Mr. Speaker, would respond that they felt a very positive experience. I would also tell you, Mr. Speaker, that the new people who are being hired into the health care system are telling you there are positive experiences. But, Mr. Speaker, we've listened to Nova Scotia. There are challenges associated in some of our communities. We're continuing to work with those communities to ensure that we attract health care providers. At the same time, Mr. Speaker, investing in the physical infrastructure that health care providers tell us is required to not only to attract but to retain those health care providers in our communities today.
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, bigger hallways is not the answer to hallway medicine. There are serious problems in the healthcare system. Everyone in this province knows we have an aging population and we have a major shift in our demographics happening in this province. But time and time again, we hear that hospitals and emergency departments are bottlenecked because the government has failed to provide adequate long-term care facilities and access to beds. And yet in this budget, there's not a single dollar for more long-term care beds. And that's a serious problem, Mr. Speaker. I'd like to ask the Premier, the system is either massively mismanaged or there are not enough long-term care beds. Which one is it, Mr. Premier?
The Honourable Premier.
Mr. Speaker, I would say for the decade that the Tories were in power, they neglected physical infrastructure in this province. That is a stark reality, Mr. Speaker. The Honourable Member may not think it's important to invest in the Cape Breton Regional, Mr. Speaker, and I can tell you the health care providers in the province do. The Honourable Member may not, Mr. Speaker, believe it's important to invest in the QE2 redevelopment, but I can tell you health care providers across this province do, Mr. Speaker. The Honourable Member is complaining about us adding another 120 long-term care beds in Cape Breton, Mr. Speaker. He may not appreciate that, Mr. Speaker, but Mr. Speaker, Cape Bretoners will, Mr. Speaker. The Honourable Member from Berwick, Argyle is standing up complaining, Mr. Speaker. Well, I'm going to tell you, the people in Matagan appreciate the redevelopment, Mr. Speaker, and the additional beds that will take place, Mr. Speaker. And I look forward Mr. Speaker, I look forward to him telling him in both official language to those people they don't deserve those bids.
The Honourable Leader of the official New Democratic Party.
In recent weeks, Mr. Speaker, in the emergency rooms of Nova Scotia, we've had people being sent home with pink sheets because the ER was too jammed up to receive them. We have people in the Cobequid being fed out of vending machines because they need to be kept there in a facility that was not intended for that. We've got doctors and nurses in Kentville and Dartmouth and Halifax and Sydney really speaking out about chaotic and untenable circumstances in their ERs. And we know that a core reason for all of this is that emergency rooms have nowhere to discharge their patients because so much of their hospitals are filled with people waiting for nursing home placements for whom there are no places. In the middle of a health care crisis where this is the case, why would the Premier bring in a budget with no comprehensive program for new nursing home construction in our province?
The Honourable Premier.
Mr. Speaker, I want to thank the gentleman for the question. Mr. Speaker, he would know the very healthcare redevelopment that he's been campaigning against in Cape Breton is adding additional long-term care beds there. Mr. Speaker, he would also know, Mr. Speaker, the long-term care facility in Metagan, as well as the one in Mahone Bay, will continue to be redeveloped at the same time adding long-term care beds to those communities. The Minister of Finance in her budget speech said there will be more opportunity as we continue to work with our partners to providing a long-term care within the fiscal envelope of the province. Mr. Speaker, he would also know the redevelopment that's happening in and around the Cape Breton Regional and here at the QE2 is providing those efficiencies in emergency rooms to ensuring that we're providing those that require emergency service will get in a timely manner, but at the same time providing the physical infrastructure so that those who are looking for primary care in our emergency rooms will have access to that in other parts of the facilities and our redevelopment components.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, Mahone Bay, Metagan, North Sydney, New Water, this is not a comprehensive provincial program. A comprehensive provincial program of long-term care facilities is the 300-bed program that was on his desk the day that became the Premier, which ended up in the garbage can. Now, I understand that this budget includes increases for emergency health services in response to increases in call volumes, but in the emergency rooms themselves, which are already up against it because there's no place to discharge their patients, this increased volume could very well have the effect, as one doctor has put it to me, of supercharging the whole emergency room problem because the new patients being brought in haven't got any place to go. Does the Premier understand that if you move more people into an already crowded space with no place for them to exit, that space is going to become more crowded than it was before?
The Honourable Premier.
Mr. Speaker, what was on my desk the day I became Premier, Mr. Speaker, was a $600 million hole left behind by the former government and a bunch of promises. Mr. Speaker, and a bunch of promises with no ability or no path to pay for them, Mr. Speaker. The budgets the honourable member has been voting against in this House, Mr. Speaker, providing a clear path to economic stability, allowing us to make the largest single investment in healthcare infrastructure in the history of this province, while retaining a balanced budget, investing in Nova Scotians, hiring more healthcare workers, and at the same time providing a realistic path to providing more long-term care beds in our communities.
The Honourable Leader of the New Democratic Party.
It would be a privilege to vote against a budget which has no place in it for a comprehensive program of nursing home replacement and building in Nova Scotia. Look, there's a consensus that is being developed about this. Doctors speak about how long-term care facilities are needed to take the pressures off ERs. Nurses are speaking in various venues about how long-term care facilities are needed in order for them to be able to provide the kind of care in ERs that's needed. Healthcare policy specialists are saying the very same thing. The only people who don't think that a comprehensive program of new nursing homes is needed for us in Nova Scotia are the 27 members of this government. What makes the Premier think that the Nova Scotia Liberals know so much more about ERs and new long-term care facilities than anybody else in Nova Scotia?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the gentleman for the question, Mr. Speaker. In his preamble, Mr. Speaker, he echoed to the voices of many healthcare providers who recognize we need to continue to provide and expand the delivery of not only primary care but long-term care. They also talked, Mr. Speaker, about ensuring that we provide home care. We continue to invest in those. The Minister today in her budget announced 4 communities that would see an increase of long-term care beds, Mr. Speaker. The honourable member is listening to those healthcare providers when it comes to long-term care beds. I hope he takes a moment in time and listens, Mr. Speaker, to the healthcare providers in Cape Breton Island, who yesterday said it was a game changer when it comes to introducing primary care in those communities, making sure cancer care, Mr. Speaker. One of them said, can you imagine what else could we do about bringing care closer to our citizens? That's exactly what happened yesterday in Cape Breton that he voted against. So he can't listen to some healthcare workers, Mr. He needs to listen to them all when we provide a comprehensive healthcare policy to our province.
The honourable leader of the official opposition.
Thank you, Mr. Speaker. This budget implies there are no issues with the delivery of EHS services. That's the exact opposite of what we're hearing from actual Nova Scotians. Paramedics, people waiting long wait times for services. Now, today's numbers, the budget today, doesn't do anything to address the issues surrounding the lack of ambulances across this province. There's no new money for EHS in this budget today. How does the Premier reconcile what's happening with ambulance backlogs at emergency departments and the lack of availability of ambulances with not providing an increase in the budget?
The Honourable Premier.
Speaker, the honourable member knows we have a contract with the EHS. We continue to implement and we continue to work with our partners, Mr. Speaker. They've continued to give us advice on how we continue to work to ensure the offload times change. We can deal with people in long-term care. We're taking and working with them, quite frankly, to provide new ways to delivering health care in our province, and we appreciate the work and advice that they are providing to us.
The Honourable Leader of the official opposition.
Premier can wring his hands and push it off to somebody else, but the reality is there's a serious problem with access to EHS in this province, and this government had a chance to acknowledge it in their budget today, and they decided not to. Mr. Speaker, anyone looking ahead can see that we need a clear vision for the delivery of health care in this province, but we don't see it in this budget. This budget says there's capacity, says there's enough nurses, says the doctors are fairly compensated. There is a crisis in healthcare, and this budget doesn't acknowledge it. I'd like to ask the Premier if the Premier really believes we have enough nurses, we have enough ambulances, doctors are fairly paid. If the Premier really believes these things, then that means the resources we have are being severely mismanaged. Which one is it, Mr. Premier?
The Honourable Premier.
Speaker, again, I want to thank the honourable member for the question, Mr. Speaker. I look forward to continuing to have budget debate as we continue to roll out all the investments that we've made in healthcare. I again want to thank the paramedics across this province who provide services in our communities, Mr. Speaker. Mr. Speaker, the fact is we pay for volume, and I would encourage the honourable member. I know we just saw the document today, Mr. Speaker, but there's a $4.6 million increase for AHS, Mr. Speaker. $4.6 million, Mr. Speaker.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, my question is for the Premier. The Intergovernmental Panel on Climate Change told the world that what is required to address the crisis of climate change is what it called a rapid escalation of the level of ambition towards containing global warming to 1.5 degrees. Today, the Minister of Finance has delivered a budget address in which the terms climate and climate change appear a total of 0 times. Does the Premier believe that a budget that shows no provincial leadership on creating green jobs, no provincial leadership on reducing emissions, no provincial leadership on investing in climate change adaptation, does the Premier believe that this demonstrates what the IPC calls this rapid escalation of a level of ambition which the world knows is called for?
The Honourable Premier.
I want to thank the honourable member for the question, and Mr. Speaker, I want to thank all Nova Scotians for continuing to lead the country in GHG reduction. Mr. Speaker, we are well. We've met our target by 2030. We're 30% below 2005 levels. Mr. Speaker, he would also know we're well on target to be about 50% by 2030. Mr. Speaker, the reality of it is, in today's budget, we announced $7 million for green infrastructure. Mr. Speaker, we had $14.3 million to help Nova Scotians with home energy efficiency to reduce their greenhouse footprint. Mr. Speaker, there's a $23 million associated directly with dealing with the green economy, creating green jobs, and helping Nova Scotians reduce their carbon footprint. Mr. Speaker, that may not seem like a lot of money to the honourable member, but Mr. Speaker, it's a lot of money to Nova Scotians.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, on the day that this legislature last met, I had the privilege here of joining hundreds of high school students and other young people who took part in a global climate strike led by the kids themselves here as around the world. These young people are calling out with strength and conviction, and also out of desperation, for politicians like us to take decisive action to address climate change, because they were very clear in that demonstration. It's their view that it's them and not us who will face the consequences of a lack of action. Mr. Speaker, what does the Premier think it says to those young people that this government's budget address today does not even include the term climate change?
The Honourable Premier.
Speaker, again, I want to thank the honourable member for the question. Mr. Speaker, those young people should be proud of the fact that successive governments of all political stripes in this province have taken this issue seriously. We continue to lead the country in our carbon footprint reduction. Mr. Speaker, those are all positive signs. But, Mr. Speaker, I want to assure those young people that were here, we're not resting on that, Mr. Speaker. Again, I just told the honourable member there's $23 to $24 million invested directly in the green economy, looking for green jobs to help us reduce our carbon footprint to deal with the very issues the honourable member is talking about. He would also know the minister is, I think, forestry has laid out a plan on coastal protection, ensuring that we deal with the issues along our coastal communities, Mr. Speaker. We continue to listen not only to those young people, Mr. Speaker, but all Nova Scotians who recognize we have an important role to play to help Canada reduce its carbon footprint, at the same time ensuring that we turn our economy into a green one.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. If it is to continue its operations, Northern Pulp will require a new effluent treatment plan. There is much speculation that the province will contribute to the cost of any such new plan. However, there's nothing allocated in the budget for that type of expenditure. Can the Premier confirm how much the province plans to contribute towards the new effluent treatment plan, and when will the province book that amount?
The Honourable Premier.
Mr. Speaker, Mr. Speaker, as I've said many times in this House, we continue to work with Northern Pulp on the issue of the cleanup of Boat Harbour. We have a liability associated with the closure of that facility almost 10 years early. That liability negotiation is still ongoing, Mr. Speaker. I want to assure the honourable member we as a government take our responsibility seriously about the liabilities associated with that particular facility, at the same time ensuring that we can keep the fiscal health of this province forward. And I also want to say to the honourable member, I'm still very optimistic, Mr. Speaker, that we can see that Northern Pulp continue to operate in that community in a way that allows us also to clean up the environment.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. The issue is the Premier acknowledges that there's a liability. That means the province will pay something. If the province is going to pay something, it should be reflected in the budget. Mr. Speaker, the Premier hasn't got around to putting it in the budget unless he wants to confirm to this House today. I asked staff today if there's anything for the new treatment plant. Nothing. Any change to the Boat Harbour cleanup? Nothing. Nothing in this budget for either of those two, which could be significant, have a significant financial impact on the province. If you don't put it in the budget, and you know it's coming, that's not being fully upfront with Nova Scotians. I'd like to give the Premier one chance to be transparent, and not hide the amount. Tell Nova Scotians what's the liability and when will you book it?
The Honourable Premier.
Mr. Speaker, Tim the negotiator, Mr. Speaker. Lay out all your cards on the table and then look for a deal, Mr. Speaker. I've said many times in this House, Mr. Speaker, I've said many times, Mr. Speaker, the fact of the matter is we don't have a liability when it comes to the treatment facility. We have a liability when it comes, Mr. Speaker, to reducing and closing Boat Harbour early. We're continuing that negotiation, Mr. Speaker. I want to assure the honourable member we continue to make arrangements to deal with our liabilities when it comes to, but Mr. Speaker, unlike former Conservative governments, Mr. Speaker, I'm not going to lay out the amount that we believe we owe. We're going to negotiate that, Mr. Speaker, just like we've done with collective agreements, Mr. Speaker, just like we continue to do to make sure, Mr. Speaker, that not only we deal with the environmental liabilities that have been ignored for decades by successive governments, but ensuring that we try to protect the jobs in the community the honourable member comes from, Mr. Speaker. And we're going to continue to make sure that we stand with the hard-working Nova Scotians, at the same time building an economy that all Nova Scotians see themselves in as we protect the environment and pay. And Mr. Speaker, and let me finish, Mr. Speaker. And Mr. Speaker, we'll do it by paying our bills on time.
I'd just like to remind the Honourable Premier not to refer to members opposite by their first names. The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. This is a very sad day for Nova Scotians. All we really heard was regurgitated funding announcements from several months ago, but what the government failed to mention was all of the critical funding cuts to health care, long-term care and seniors. So we need some help, and maybe we'll get it from the federal government. I recently attended a town hall meeting with the Federal Minister of Seniors and asked her if she would commit to ensuring that our health transfer payments were based on the age of our population, not the number of people. However, she had no idea what the federal health minister's policy was. It's troubling to me that she had no idea. So I'm going to ask the question to the Minister of Health. Does he know what the federal Minister of Health's policy is on this? And does he personally believe that the health transfer payments to our province should be based on the age of our population?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. As the member and the members opposite may realize, I think a former Conservative federal government changed the approach to the Canada Health Transfer Program, Mr. Speaker, and that's when it changed to a population-based distribution, Mr. Speaker. That continues to be a foundational part of the funding model used by the federal government for the Canada Health transfers.
The Honourable Member for Cole Harbour, Eastern Passage.
So I had no idea whether that was a yes or a no, but we'll move on. Mr. Speaker, our aging population has high levels of chronic illness, and it occupies nearly 50% of our health care budget. We are a small province and we've got large needs, and this budget shows that this government does not know how to address those needs. Without proper advocacy from the Premier and his Minister of Health, it's unlikely that our funding from the federal government will change, and you've had 6 years to work on this to more accurately reflect our demographics. This budget shows cuts to adult protection. Nova Scotia government cuts to client-specific expenses for long-term care, cuts to the Nova Scotia government for long-term care infrastructure. My question to the minister is, will the minister commit to advocating now for the needs of Nova Scotians' elderly population with his federal counterparts?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Through the Canada Health transfers, I've mentioned one of the foundational pieces of the formula used by the federal government does include population-based part of the formula. It's good news, Mr. Speaker, that in our province we've been increasing our population the last number of years to help improve the transfers that we're receiving, Mr. Speaker. In addition, Mr. Speaker, the work and the investments we've made investing significantly in our home care support programs, Mr. Speaker, and various programs to help support our aging population, Mr. Speaker. That's exactly what the member, if she looks through this budget, will see that we're supporting our aging populations.
The Honourable Member for Cole Harbour, Eastern Passage.
So, Mr. Speaker, I still don't know whether he believes it should be based on age or population. Mr. Speaker, recently we made a call to all major home care providers and HRM that are funded by the provincial government. None of them are willing to directly bill the private health insurance companies for our seniors. This forces seniors to pay upfront up to $500 or more for benefits that they actually have coverage for. These administrative costs and additional hassles have made the private health insurers that our government has chosen to provide service contracts to the ability to avoid that problem. Adequate and affordable home care is a vital part of this government's funding, so I'm going to ask this government, can the Minister of Health explain to me why direct billing to private health plans continues to be optional rather than an expected service provided by his service providers in this province?
The Honourable Minister of Health.
Thank you, Mr. Speaker. The service providers for home care services, we've invested heavily since forming government in 2013, Mr. Speaker. We've recognized and heard from Nova Scotians who indicate that they want and are able to live in their homes longer with appropriate supports. Mr. Speaker, that's why we've invested to provide more access and more contact hours through our home care providers, Mr. Speaker. So we are listening to the Nova Scotians who require and can take advantage of this support as they age in their home, in their community, and will continue to do that.
The Honourable Member for Cole Harbour, Eastern Passage.
Mr. Speaker, I'll point out again that my question was, why are his service providers allowed to not directly bill? And again, I didn't get an answer. So, Mr. Speaker, we'll talk about long-term care beds. This government is finally admitting that we need more long-term care beds, something that the opposition have been calling for the past 6 years since they've been in government. The Nova Scotia Health Authority charges a daily fee to people staying in acute care beds while awaiting placement in long-term care. They get that bill sent at the end of the month unless they live in Cape Breton, in which case they get it up front. When a patient receives placement in a long-term care facility, they've got to pay before they move in. So this means that we're double billing all of those seniors in acute care beds who are about to go into long-term care, and I don't know too many seniors who can afford this. So can the minister tell me, does he believe that the current billing process is properly set up to ensure that our seniors are able to fully cover their expenses without bankrupting them?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, the fees being charged by the Nova Scotia Health Authority for Nova Scotians that have been assessed and are waiting for a long-term care placement is to cover the accommodation costs only, Mr. Speaker. Any medical costs associated continue to be covered. With respect to the number of Nova Scotians that would be in that situation, Mr. Speaker, we've been seeing improvements with fewer Nova Scotians waiting specifically for long-term care access in our hospitals, and those that have been waiting, Mr. Speaker, have been waiting less time to get placed from a hospital into a long-term care facility.
The Honourable Member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. Over the past several weeks, Nova Scotians have been sounding the alarm about the state of emergency care. In North Sydney and Dartmouth, patients have been told to go home without being seen because the emergency department is just too crowded to see them. Imagine being a parent with a sick child, no family doctor, then showing up at an emergency room only to be told that there's no room for you either. Mr. Speaker, will the minister admit this budget does nothing to address the crisis in our emergency rooms that is putting Nova Scotians at risk?
The Honourable Minister of Health.
Thank you, Mr. Speaker. This budget supports our healthcare system. This is a significant part of our budget, Mr. Speaker, the speech and the budget that was tabled by my colleague, the Minister of Finance, earlier today. So, Mr. Speaker, I believe this budget is working to invest and improve the delivery of healthcare services throughout the system. Mr. Speaker, the healthcare system is tightly integrated. Improvements in primary care supports and access can help reduce pressures in our emergency departments, the expansion and the continued expansion of collaborative care practices to help improve primary care access throughout our communities, Mr. Speaker. These are steps that will help improve, reduce the pressures in our emergency departments. Just one part of the investments being made, $10 million additional in this budget this year.
The Honourable Member for Cape Breton Centre.
Thank you, Mr. Speaker. Sadly, though, Mr. Speaker, that is down the road in the future. That's not addressing the crisis that is resulting in people dying today. As the member from the paramedics said, if the ambulance isn't there, they will die. So the crisis is today, Mr. Speaker, not in 2020 or 2025. Mr. Speaker, for the second year in a row, the budget includes payments to EHS because there are more people in need of ambulances in the province. Not only are paramedics struggling to offload patients in overcrowded emergency rooms, but also patients cannot be admitted to hospitals because there's hundreds of people in the hospital who are waiting for long-term care. Mr. Speaker, will the minister acknowledge that sending more people to an overcrowded emergency department will just make things worse?
The Honourable Minister of Health.
Mr. Speaker, I apologize. I'm not sure I understand the essence of what the member was getting at there. What I can tell the member, though, Mr. Speaker, is as I answered in my first response, Mr. Speaker, we're actually investing over an additional $10 million this year to increase primary care access through collaborative care teams, Mr. Speaker.
Please. The Honourable Minister of Health.
That investment to establish new and expand existing collaborative care practices for primary care, Mr. Speaker, is exactly about keeping people to receive the care that they need through primary care providers in their communities to keep them out of the emergency departments. Mr. Speaker, I hope the member opposite is not suggesting that Nova Scotians should not be calling an ambulance. In fact, they should be. If they have a medical emergency, Mr. Speaker, to call the ambulance, and the ambulance will get you to the emergency department. You will be triaged. You will receive your emergency care, Mr. Speaker, that you need and deserve, because that's what our dedicated healthcare professionals on the front line are doing.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. This government seems to be under the impression that commissioning a report is equivalent to solving a problem. Many great recommendations came from the dementia strategy 4 years ago, but very few of them have been implemented. I fear that this year's long-term care report is headed for the same fate. This government today announced a whole $2.8 million to fund the recommendations from the long-term care report. That's going to improve wound care, service coordination, and staffing. Does this Minister of Health I would be embarrassed to clap at that. Does this minister really believe that $2.8 million in funding is going to actually fulfill the dozens of recommendations made in the long-term care report?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for drawing attention to this important work that was conducted over the fall, Mr. Speaker, by an expert panel of individuals, physicians and nurses, Mr. Speaker, to provide us with recommendations. If the member refers back to that report, what you will notice, Mr. Speaker, is that it is a culmination of short, medium, and long-term recommendations, Mr. Speaker. What we are investing in, that the member highlighted, investments of $2.8 million in this fiscal year. That's on top of $2.2 million, Mr. Speaker, that we announced last week. Mr. Speaker, we're investing, that's $5 million of new investment into technology equipment as well as programming supports, Mr. Speaker, for our long-term care sector.
The honourable member for Cole Harbour Eastern Passage.
Mr. Speaker, I am as embarrassed as a health professional and as a politician that they would be clapping to these types of announcements, including the money for mattresses and slings and long-term care beds, which should have been in there all along. Mr. Speaker, I came from this morning presenting at a long-term care conference in Dartmouth, and I guarantee you they have a very different opinion of how this government is doing. Nova Scotians are tired of being hopeful about a report only to having it end up on a shelf. The dementia strategy, the 2010 Better Care Sooner report on emergency care, the list of reports goes on and on. I understand that implementing recommendations costs money, but $2.8 million for all of those recommendations for long-term care isn't going to get somebody to the toilet, isn't going to get their bathroom privileges done. Given this government's track record with the implementation of reports, my question to the Minister of Health is, will he commit to implementing all of the recommendations of the long-term care report, and will he provide sufficient funding to do so?
The Honourable Minister of Health.
Mr. Speaker, as I responded in my first response to this set of questions, I made it clear, going back to the recommendation that we received in January, Mr. Speaker, the panel recognized that the nature of the recommendations, there are a number of short-term, within 6 to 18 months, Mr. Speaker, and longer-term initiatives to be implemented. This budget that we announced today, Mr. Speaker, is about this coming fiscal year and investments that we're going to be making. Mr. Speaker, that does not reflect the total duration of time that even the expert panel and the recommendations suggested that the efforts would take to implement all of those recommendations. But we're here talking about the investments being made. That's $2.8 million in today's budget, 2.2 that we announced just last week. It's $5 million, Mr. Speaker, going towards the start of the work to implement recommendations that were made just in January.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, my questions to the Minister of Health. 2 of my constituents are moving to Halifax because their family home in Mill Village has become too much for them. They are lucky to have a family doctor in Liverpool, and although she's agreed to keep them as patients, the commute back and forth to their appointments is simply too much for them. They've contacted 811, NSHA Patient Feedback, and NSHA Media Communications, and have yet to receive a clear answer as to whether or not they can join the 811 list and keep their current doctor. My question for the Minister is, are my constituents able to join the 811 list without giving up their current doctor until they have a new one?
The Honourable Minister of Health.
Mr. Speaker, Nova Scotians Mr. Speaker, Nova Scotians can register either by calling or through online to the 811 Need a Family Practice. Mr. Speaker, many Nova Scotians are doing that, whether they're expecting their physicians to retire coming up. So, Mr. Speaker, I believe there are many Nova Scotians who are registered on the list with the anticipation of their physician retirement. So I would see that possibility being there to be registered so they know when a new physician may be available.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker, and I'm glad to hear that response. But I will say that the different bodies of the NSHA that they've contacted have used the word probably and reminded them that the list is for people without a doctor, not people looking for a different one. Nothing they've heard has given them confidence that they would be able to keep their doctor until they were matched with one closer to their new home. Everything they've heard has felt like it easily could be rescinded. So my question is, can the minister provide peace of mind and assure me that once their name is on the 811 list, it will remain there until they are matched with a new doctor in Halifax?
The Honourable Minister of Health.
Thank you, Mr. Speaker. The work that goes on to verify the process, people do get matched with physicians. Then the physicians who are taking on new patients, Mr. Speaker, are being cross-referenced to verify that people have been attached through that, Mr. Speaker. In addition, Mr. Speaker, there are efforts to contact people who are waiting on a list to find out if they have been attached to verify before individuals are being taken off of that list. So, Mr. Speaker, they're either hearing directly from the physicians that they've been attached or primary care providers, or, Mr. Speaker, they're following up with the residents themselves that are waiting on the list to verify when they come off of that list.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. Mr. Speaker, when the government cancelled the grant program for those taking the continuing care assistant course at NSSC, the number of people registered for the course plummeted. This drop in registration has had a devastating effect on the ability of both private and public continuing care providers to hire and supply enough staff. In a long-term care report released in January, it was recommended the grant program be reinstated. So my question to the Minister in Labour and Advanced Education is, will he commit to restoring the grant program for the CCA program?
The Honourable Minister of Labour and Advanced Education.
Mr. Speaker, I'm not aware of the cancellation of that program. I'm more than willing to look into it. If the member would like to provide information, I can do that. Thank you.
The Honourable Member for Northside Westmount.
Mr. Speaker, last year only 85% of the NSCC seats for the CCA program were filled. That's only 307 students, Mr. Speaker. When the grant program was in place, there was between 800 and 1,100 students being trained each year. That was the last time we did not have a CCA hiring issue. In other professions with recruiting and retention difficulties, the government has stepped in and implemented programs to help encourage students. Can the minister tell Nova Scotians why the NSCC received grant funding from the government to recruit early childhood educators, but there's been no such funding to fill the seats for the CCA program?
The Honourable Minister of Labour and Advanced Education.
Mr. Speaker, again, as I mentioned earlier, I'm not aware of any cuts to any funding for that. And I can say to the member that the early childhood funding was put in place because our government brought in a pre-primary program which is providing program care to all 4-year-olds in the province. And that created a lot of...
Please. Order, please. The Honourable Minister of Labour.
Thank you, Mr. Speaker. So as I was mentioning, we provided the funding for education because our education department brought in a pre-primary program which is providing...
Order, please. The Honourable Member for Northside Westmount will come to order. The Honourable Minister of Labour.
Thank you, Mr. Speaker. Maybe I can get my point across without being interrupted this time. So, Mr. Speaker, as I said, the reason that we brought in program funding for the NSCC was because we brought in...
Order, please. If I have to call order one more time for the interruptions and to acknowledge the disrespect for this chair, people will start to leave. The Honourable Minister of Labour.
Thank you, Mr. Speaker. So for a 4th time, Mr. Speaker, our government brought in a pre-primary program. We needed to hire many professionals for that, and what we did is we worked with our partners at the Nova Scotia Community College. We funded those seats, and Mr. Speaker, I'm very proud of this government to have that program in place, and we're providing pre-primary program to all kids in the near future. And Mr. Speaker, it's great that we're well on this way of this program. Thank you.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. I have all of the information that the Minister of Labour and Advanced Education needs with respect to that grant program. I'll be happy to provide it. Mr. Speaker, The caregiver allowance is one of the programs that the Premier ministers tend to boast about, and we're happy about that. But I see no new increase in funds for this program, despite the fact that there are more and more people waiting for long-term care beds and the cost of care is going up. The threshold for this program remains such that, in my opinion, there are too many people who are unable to take advantage of it. Outside of an emergency, the majority of government programs to help seniors and caregivers have unrealistically low income levels. My question is to the Minister of Health. Can he explain why only those with severe cognitive limitations are eligible for programs like the Adult Day Program, while those with physical limitations are left without support?
The Honourable Minister of Health.
Thank you. Thank you, Mr. Speaker. This is a program that we expanded last year, Mr. Speaker, and part of the process that we took for the expansion last year was actually looking at and expanding the access based upon the needs assessment of the residents, Mr. Speaker, of Nova Scotia. So we did expand based upon the criteria, the medical criteria of the assessment for these individuals, so that more Nova Scotians last year would be made available for this particular program.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. There are smaller organizations like Caregivers Nova Scotia who are trying to compensate for the lack of planning on this government's part, and they are the backbone of supporting our crumbling health system. Caregivers Nova Scotia helps Nova Scotians navigate the resources and provide education, which helps this government's Home First philosophy. Unfortunately, with a small budget, and I don't see any increase in this budget, they are underfunded and overutilized to the point where they only have one coordinator for all of Cape Breton, the South Shore, the northern areas, and only 1.5 in Metro. Many caregivers are forced to leave their jobs to care for loved ones, and they need help from our government. Can the government's Home First philosophy and relief that caregivers provide to the healthcare system, they need extra help. Can the minister tell me what other resources does this budget offer to the caregivers in Nova Scotia beyond what was already announced over the past 5 years?
The Honourable Minister of Health.
Thank you, Mr. Speaker. We invest in supporting Nova Scotians who choose to stay in their homes longer. Mr. Speaker, that includes the investments. The investments we've been making, those investments, Mr. Speaker, that we've made in previous years carry forward as costs of these investments into the current year and into future years, Mr. Speaker, as we continue to deliver these programs. Those include significant investments to support our home care providers, like I just mentioned in the first response, the expansion of eligibility for the caregiver benefit, Mr. Speaker, but also the supports for home care programs and supports, Mr. Speaker, of home care programs, as well as, Mr. Speaker, the medical needs. Thank you.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Finance. In her budget address, the minister stated, "We are expanding childcare services, investing $67 million this year." But in fact, Mr. Speaker, there hasn't been an expansion at all. The government has invested no new money, when what we need is a universal system of affordable childcare in order to achieve an equitable and expanded workforce. Mr. Speaker, can the minister confirm that this is in fact a status quo budget with no new money for licensed childcare?
The Honourable Minister of Finance.
Thank you, Mr. Speaker. And as far as the comment about this being a status quo budget, I think the members should actually look at the increase, 6.2% increase in health care alone, 2.3% in education alone. Mr. Speaker, that's not status quo.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. So no new funding, despite the fact that it's called new, for licensed childcare. Earlier this month, I asked the minister about women's economic security, and at that time she indicated that her department did gender-based analysis of their work. However, when we requested through Freedom of Information the gender-based analyses of budgets, legislations, programs, or policies, we received a letter, and I'll table it, saying that no such records exist. Mr. Speaker, will the minister table the gender-based analysis that supports this status quo budget for licensed childcare?
The Honourable Minister of Finance.
Thank you, Mr. Speaker. I believe the question about gender-based was based on a comment that was made by the federal government about their using gender-based budgeting for their process. I indicated that we were not using gender-based budget, but we were certainly looking through a gender-based lens on every program and every policy that we implement.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. There are many seniors in Nova Scotia who don't have access to a family doctor, so getting a prescription is already difficult enough. Pharmacists have the legal right to prescribe and refill certain medications, which could allow seniors to access these medications they need when they don't have a family doctor. However, the support has not been provided through MSI to compensate pharmacists for this, which doesn't seem fair when they compensate physicians. It's unreasonable to ask a pharmacist to donate his time or her time to take on more responsibility without compensating them for it. My question to the Minister of Health is, has the government considered enhancing the role of pharmacists to fill the gaps left by family doctor shortage in this area, both by providing them with MSI billing codes in order to allow them to be compensated for providing this needed service?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for bringing to the floor a recognition, acknowledgement of the pharmacists in this province, Mr. Speaker. Pharmacists that operate in I think approximately 305 community pharmacies across the province, Mr. Speaker, providing care directly to Nova Scotians. We've seen in recent years the expansion of their scope of practice, but in particular, Mr. Speaker, I want to acknowledge how great our relationship has been with the PANs and the pharmacies, bringing to new programs like the Bloom program, providing support around mental health conditions, Mr. Speaker. Work with, Mr. Speaker, addiction treatments and the delivery of naloxone as a naloxone out to individuals in communities to help address opioid overdose. Mr. Speaker, we have a great working relationship. We continue to work with the concerns that they bring forward to us.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. For far too long, the focus has been on acute care and crisis management. The doctor shortage is widespread in this province and it's happening everywhere. We need to be creative and innovative to our response to ensure that Nova Scotians of all ages receive the care that they deserve. There are rehabilitation specialists, social workers, community services staff, continuing care staff, and I notice that some of those areas have funding cuts in this budget. Can the Minister of Health tell me how many professions in this budget are getting an increase in the number of healthcare professionals to provide social work care, to provide physiotherapy care, in the home care, in health care? We can't look at this budget and figure out whether staffing has gone up or down.
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, since the last number of years, we've been investing and expanding access, particularly in the primary health care space, Mr. Speaker, as part of our investments in collaborative practices in communities across the province. That's where, Mr. Speaker, you're seeing a number of those allied health professionals, including nurses, including the social workers, Mr. Speaker, coming and having those opportunities to provide care. In this budget, Mr. Speaker, we invested an additional $10 million to continue the expansion and introduce new collaborative care practices across the province. That's on top of the investments. And in the past, Mr. Speaker, since March of 2017, we've hired 130 healthcare professionals to support these collaborative teams. This $10 million will go to hire even more.
The honourable member for Sackville-Beaverbank.
Thank you very much, Mr. Speaker. Mr. Speaker, the United Nations, World Health Organization, Intergovernmental Panel on Climate Change, they've all stated that the largest threat to the global economy is climate change. Mr. Speaker, the World Economic Forum identified climate change as a dominant threat to health in 2019. My question through you, Mr. Speaker, to the Minister of Department of Environment is, does she really feel that 0.018% of an overall budget shows commitment of this government towards addressing climate change?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker, and thank the honourable member for the question. I absolutely believe that this budget is exactly targeting climate change through many initiatives I also want to thank Nova Scotians for showing leadership and how we are the leaders in climate change mitigation. We have very aggressive targets that are going to bring us to 45 to 50% reduction in greenhouse gas emissions by the year 2030. That's a leader across this country. Thank you.
The honourable member for Sackville-Beaverbank.
Yes, thank you very much, Mr. Speaker. And I want to point out that there is a difference between mitigation of climate change and addressing the issues on a proactive, go-forward way. And I don't think at all that this budget is addressing on a go-forward, proactive way. In fact, I want to ask again. So I look at this budget, I see just over $2 million towards climate change of an $11 billion budget. So I'm asking the minister again. She feels that $2 million of an $11 billion budget is enough to address climate change.
The Honourable Minister of the Environment with 20 seconds.
Yeah, I thank the honourable member for the question. I'm afraid he wasn't listening earlier when the Premier actually spoke to the same issue, you know, highlighting $23 million in this budget towards climate change initiatives. You know, Mr. Speaker, you know, this House is
Order,
seeing...
please. Time allotted for oral questions put by members to ministers has expired.